Cancer is a word that carries weight, evoking emotions ranging from fear to hope. It's a complex and challenging disease that has touched nearly every life in some way. But what exactly is cancer? At its most fundamental level, cancer is a disease of uncontrolled cell growth, where the body's own cells begin to grow and divide uncontrollably. To fully grasp this, let's first understand how cells are supposed to function in a healthy body. Our bodies are made up of trillions of cells, each performing specific tasks that contribute to our overall health and functioning. These cells follow a well-organized cycle. They grow, replicate to replace old or damaged cells, and then die when their job is done, a process known as apoptosis. This cycle is tightly regulated by numerous checks and balances within the body to ensure that everything functions smoothly. Imagine a city where every citizen has a specific role, follows the law, and maintains order. This is similar to how healthy cells operate within our bodies. However, cancer disrupts this order. It's like an anarchic rebellion within this city, where some citizens, cells, start ignoring the rules. Cancer cells behave abnormally. They don't die when they should, and they continue to divide and grow without the normal regulatory controls. This leads to the formation of masses of abnormal cells known as tumors. These tumors can interfere with the normal functioning of the body by invading surrounding tissues and organs. Cancer is not a single disease, but rather a group of related diseases. There are more than 100 types of cancer, each classified based on the origin of the abnormal cell growth. For instance, carcinomas are cancers that begin in the skin or the tissue linings of internal organs, while sarcomas start in the bone, cartilage, fat, muscle, or other connective tissues. Leukemias are cancers of the blood and bone marrow, and lymphomas and myelomas are cancers that begin in the cells of the immune system. Despite their differences, all cancers share the common characteristic of uncontrolled cell growth. The prevalence of cancer is staggering. The burden of cancer extends beyond the physical, affecting families emotionally and financially. The economic impact is also immense, with billions spent annually on treatment, research, and care. But cancer's impact is not just in the numbers. It is a disease that fundamentally changes lives, altering the way people see themselves, their futures, and their relationships with others. It challenges patients to confront their mortality and often leads to profound emotional and psychological struggles. Despite the fear and uncertainty that cancer brings, it's important to remember that it's also a disease that we understand better now than ever before. Over the past few decades, incredible advancements have been made in understanding the biology of cancer, leading to more effective treatments and improved survival rates. Today, many people live full lives after a cancer diagnosis, thanks to early detection and advanced therapies. The journey of understanding cancer begins with recognizing it as an unwelcome guest in the body, one that disrupts the normal functioning of cells and leads to serious health consequences. But by studying how this disease begins and progresses, we can develop better strategies to detect, treat, and ultimately prevent it. Chapter 2: The Genetic Rebellion. At the heart of every cancer case lies a story of genetic rebellion. Our bodies are built on a foundation of DNA, the molecule that carries the genetic instructions for all of our biological processes. DNA is the blueprint for life, dictating everything from the color of our eyes to how our cells grow, divide, and die. However, when this blueprint is altered through mutations, cells can start to behave in ways that lead to cancer. The role of DNA mutations in cancer development. Mutations are changes in the DNA sequence, and they can happen for various reasons. Some mutations occur randomly during cell division, a natural process where cells replicate their DNA to create new cells. With billions of DNA base pairs in each cell, it's inevitable that mistakes will sometimes happen. While most of these errors are harmless or corrected by the body's repair mechanisms, some can slip through the cracks. Other mutations are induced by external factors, such as exposure to radiation, harmful chemicals, or viruses. For example, ultraviolet, UV radiation from the sun can damage the DNA in skin cells, leading to mutations that may result in skin cancer. Similarly, smoking introduces carcinogens that can cause mutations in lung cells, dramatically increasing the risk of lung cancer. When mutations affect genes that regulate cell growth and division, the stage is set for cancer. These genes can be broadly categorized into two groups: oncogenes and tumor suppressor genes. Oncogenes and tumor suppressor genes. Oncogenes are like the gas pedal in a car. In their normal state, known as proto-oncogenes, they play a crucial role in promoting cell growth and division. However, when these genes become mutated, they can be stuck in the on position, leading to uncontrolled cell proliferation. This is analogous to a car speeding out of control because the gas pedal is stuck. On the flip side, tumor suppressor genes act like the brakes in a car. They are responsible for slowing down cell division, repairing DNA errors, and initiating cell death when necessary. When these genes are mutated or inactivated, the brakes fail, allowing cells to multiply unchecked. This loss of regulation can lead to the formation of tumors. For cancer to develop, it typically requires multiple mutations in both oncogenes and tumor suppressor genes. This multi-step process is one reason why cancer is more common in older individuals. Over time, cells accumulate more mutations, increasing the likelihood of cancerous growth. Inherited versus acquired mutations. Not all mutations are acquired during a person's life. Some are inherited, passed down from parents to their children. Inherited mutations are present in every cell of the body and can predispose individuals to certain types of cancer. For example, mutations in the BRCA1 and BRCA2 genes significantly increase the risk of breast and ovarian cancers. Individuals with these mutations have a higher chance of developing cancer at a younger age compared to those without them. Acquired mutations, however, are not inherited and only occur in specific cells during a person's lifetime. These are the most common cause of cancer. They can result from environmental exposures, such as smoking, exposure to asbestos, or infections with certain viruses, or simply from random errors during cell division. Unlike inherited mutations, acquired mutations do not pass on to offspring. The process of cancer development through genetic mutations is a complex and gradual one. It often takes years, or even decades, for enough mutations to accumulate for cancer to develop. This slow and insidious process underscores the importance of understanding our genetic risks and taking preventive measures to reduce our exposure to environmental factors that can increase the likelihood of mutations. Chapter 3. The tumor's rise. Once a cell has accumulated enough mutations to disrupt its normal regulatory processes, it begins to behave abnormally, dividing and growing uncontrollably. This is where the transformation from a single rogue cell to a noticeable mass or tumor begins. When cells divide without the normal checks and balances, they can form a cluster of abnormal cells. This cluster continues to grow as the mutated cells keep dividing unchecked. Over time, this mass of cells can develop into a tumor. Tumors are typically categorized as benign or malignant. Benign tumors are non-cancerous. They tend to grow slowly and remain localized, meaning they do not spread to other parts of the body. While benign tumors can still cause problems, especially if they press on vital organs or disrupt normal bodily functions, they are generally less dangerous than malignant tumors. Benign tumors are often successfully removed through surgery and are less likely to recur. Malignant tumors, on the other hand, are cancerous and far more dangerous. These tumors grow rapidly and aggressively, invading nearby tissues and organs. They have the potential to spread beyond their original site, a process known as metastasis. Metastasis occurs when cancer cells break away from the primary tumor, travel through the bloodstream or lymphatic system, and establish new tumors in other parts of the body. The process of metastasis. Metastasis is one of the most feared aspects of cancer because it makes the disease much more difficult to treat. When cancer cells spread to other parts of the body, they can disrupt the function of multiple organs, complicating treatment and reducing the chances of successful recovery. For instance, breast cancer cells might travel to the bones, liver, or brain, forming secondary tumors that require different treatment approaches. The ability of cancer to spread is what often makes it so deadly. While a localized tumor might be treatable with surgery or radiation, metastatic cancer often requires systemic treatments like chemotherapy or targeted therapies that can reach cancer cells throughout the body. The impact of cancer on the body varies widely depending on the type of cancer, its location, and how advanced it is. Tumors can obstruct or damage organs, leading to symptoms that range from mild to life-threatening. For example, a tumor in the lungs might block airways, causing breathing difficulties, persistent coughing, or chest pain. A brain tumor can affect neurological functions, leading to headaches, seizures, or cognitive impairments. Cancer in the bones might weaken them, making fractures more likely. As cancer progresses, it can lead to a host of systemic symptoms, including weight loss, fatigue, and anemia. These symptoms result from the body's response to the growing tumor and the cancer's consumption of the body's resources. Chapter 4. The Body's Fight Back. While cancer is a formidable adversary, the body is not without its defenses. The immune system, our body's natural defense mechanism, plays a critical role in identifying and destroying abnormal cells, including those that could become cancerous. The immune system is composed of various cells, tissues, and organs that work together to protect the body from invaders like bacteria, viruses, and cancer cells. Immune cells constantly patrol the body, looking for signs of damage or abnormality. When they encounter cells that display unusual characteristics such as mutations, they launch an attack to eliminate these potential threats. For the most part, the immune system is highly effective at its job. It's believed that our bodies develop cancer cells fairly regularly, but the immune system is usually able to recognize and destroy these cells before they can form a tumor. This process is known as immune surveillance. Cancer's evasion tactics. However, cancer cells are not passive targets. They have developed sophisticated mechanisms to evade the immune system's defenses. For example, cancer cells can produce proteins that suppress immune responses or create a microenvironment that protects them from immune attack. Some cancers even exploit immune checkpoints, molecules that normally prevent the immune system from attacking healthy cells, to avoid being targeted. These evasion tactics allow cancer to grow and spread without being detected or destroyed by the immune system. This ability to hide from the immune system is one of the reasons why cancer can progress to such an advanced stage before it is detected. Chapter 5. The Arsenal of Weapons. When it comes to treating cancer, there is no one-size-fits-all approach. Instead, doctors have an arsenal of weapons at their disposal, each tailored to the specific type and stage of cancer. Surgery is often the first line of defense. If the cancer is localized and accessible, removing the tumor can be an effective treatment. Surgery may also be used to remove lymph nodes or other tissues to prevent the spread of cancer. Radiation therapy uses high-energy rays to target and destroy cancer cells. It is often used in conjunction with other treatments, such as surgery or chemotherapy, to shrink tumors before surgery or eliminate any remaining cancer cells afterward. Chemotherapy involves the use of powerful drugs that target rapidly dividing cells, a hallmark of cancer. While chemotherapy can be effective in killing cancer cells, it also affects healthy cells that divide quickly, such as those in the hair, digestive tract, and bone marrow, leading to side effects like hair loss, nausea, and weakened immunity. Targeted therapies are a more recent development. These drugs are designed to target specific molecules involved in cancer cell growth and survival. Chapter 6. The Quest for Prevention. While treating cancer is crucial, preventing it is equally important. Many cancers can be prevented by making healthy lifestyle choices and avoiding known risk factors. Lifestyle factors such as smoking, excessive alcohol consumption, poor diet, and lack of physical activity can increase the risk of developing cancer. On the other hand, a healthy diet rich in fruits and vegetables, regular exercise, and avoiding tobacco and excessive alcohol can significantly reduce cancer risk. Protecting skin from excessive sun exposure and avoiding known carcinogens, such as certain chemicals and pollutants, are also important preventive measures. Screening and early detection play a vital role in catching cancer in its early stages when it is most treatable. Regular screenings, such as mammograms for breast cancer, pap smears for cervical cancer, and colonoscopies for colorectal cancer, can detect abnormalities before they develop into advanced cancer. Early detection not only improves the chances of successful treatment, but can also prevent cancer from spreading to other parts of the body. Ongoing research is continuously improving our understanding of cancer and leading to new prevention strategies. Advances in genetics, for example, are enabling personalized risk assessments, allowing individuals to take proactive steps based on their genetic predisposition to certain cancers. Vaccines like the HPV vaccine are already helping to prevent cancers caused by viruses, and researchers are exploring new ways to prevent cancer through vaccination and other innovative approaches. Cancer is a formidable opponent, but it is not an invincible one. Through a combination of understanding its causes, early detection, and advances in treatment, we are making significant strides in the fight against this disease. The progress made in recent decades offers hope to millions of people worldwide. While the journey is far from over, the ongoing efforts of scientists, healthcare professionals, and patients themselves are bringing us closer to a world where cancer is no longer a death sentence.